Hey guys, hey, how you guys are doing? Is you guys are doing? Because I have had it rough. I just made a 25-minute video that I will not upload because I went cuckoo for Cocoa Puffs and I needed it. Sometimes I make videos where I just absolutely go cuckoo for Cocoa Puffs and say everything that I want to say and get it all out, and that way I can, have a more cohesive video afterwards. So I just had a 25-minute verbal diarrhea video of where I was losing my shit, and now I can actually talk to you without going off my rocker. So, last video I was telling you guys that I had some exciting stuff that I was looking forward to. I will get to that. So let's start with somebody said something funny. They're like, do you know how hard it is to bloom when it's cold and the ground is frozen and you have arthritis? And that cracked me up because that is essentially me. Like, I'm trying so desperately to plant myself in this place, and it is the fucking ground is rock hard, and like no matter how hard I keep pushing myself in there and trying to give myself sunlight to grow, it's like we are not compatible. Like there's too much shade, or there's not enough water, or there's too much water, or whatever it is. Like, me and this fucking place are just not 100% compatible, and it's making me fucking crazy. But I'm trying. But I try every single solitary day to get up and be like, you know what? I'm alive. I am alive. I have done the best I can with what I've been given. I am thankful to God that I'm awake today, that, Evelyn gave me a kiss before she went off to work, that she will come home to me, that, my dogs are okay, that my friends are all right, that my mother is alive. Every day I wake up and I think, well, thank you, God. Thank you for the little things that, most people take. I have a dog hair somewhere. Yuki is shedding her second coat, and it's because we didn't really get a fall and we didn't really get a summer. So all of her hair, even though I furminated her, is falling out. So every inch of my house is covered in white fur, and it's making me crazy. So there is a hair somewhere that keeps gravitating on my face no matter where I rub it, and it is like being sucked into my nose and tickling me. So I want to reiterate a few things from my last video. I'm still going to get my EGD done on the 5th, and I'm still thinking about having the stoma tightened, and here's why. The only reason I don't go for that procedure is if that he thinks that that there's something wrong in there that needs to be fixed, or if he thinks that because I swallow a lot of vitamins at one time just to get them over with. Please stop aggravating me, nose. I swallow a lot of pills at certain times of days, certain time of the day, and I don't want to have to be one of those people who like one swallow, and then have to sit there and wait. And plus, I crush some of my pills, and if my stomach is too tight and it sits on the bottom of my stomach, I'm worried that I might get an ulcer, or something might happen. So I'm really going to talk to him about it, because if that's dangerous for me, or it's going to change, how much I'm able to eat. We were looking more into giving me restrictions so my blood sugar would stabilize a little bit better, like food would stay in my stomach a bit later. That some of the medications that I take would have longer to digest. But we kind of need to play with that, and I want to just talk to him about it before I'm like, oh yeah, I'm definitely going to get this procedure. So my leg is falling asleep. Hold on. So I want to talk about a few things really quickly. I want to get this off my mind, so that when I do talk about the rest of the video, I'm not still really upset about it. So Um, this is not directed towards anybody specifically. Like, I don't have somebody in the back of my mind, like the Thomas or Gerald or, I don't have somebody specific name sitting there, and I'm not like giving you the big FU, like you personally. It has nothing to do with you personally. I'm talking because this makes me feel better, and a lot of times I need an outlet. So somebody wrote on my thing yesterday that TRICARE has been very good to me and has given me 3 weight loss surgeries. Now, I'm going to say something that a lot of you might not particularly care for or might think that is wrong. You do you, boo boo. I'm going to do me. So this is how I feel, and you're experiencing the name up here is Nirvana, and that happens to be me. So what my opinion is on myself is kind of my opinion, and I can have that because this is my channel and you clicked my video. So I don't really mind if you don't agree with me, because we're not the same person and we're not always going to agree on everything, but we can be friendly, and we can agree to disagree on some things. So again, if there's a shoe here and you're looking at it and you go, this motherfucker looks like it might fit, and then you slip it on, that's not me putting the shoe on you, boo boo. Like, that's you taking the shoe and looking at your foot and being like, I think this might fit me, because I guarantee you I have another pair to fit it somewhere else if that's what you really want. But again, I'm not trying my damnedest to hurt anybody's particular feelings. Like, that's going to be on you. So you take what you need from this video, or you don't take what you need from this video, or you could just be like, Nirvana's a big old bitch, and I never want to talk to her again, and I never want to watch her videos, because that's perfectly fine with me, because I can't control anybody else, just like what I'm about to say. So I am forever grateful for my insurance. I'm forever grateful for the chances that I've had, and all the surgeries that I've had, and all the medication that I take. I am thankful every day. I pray every night. I am beyond thankful that I get, what I have. But had they done my surgery correctly the first time, had I had the 30%, had I had the DS the first time, had they given me the sleeve instead of the R&Y, had they not just given me 10%, had they not fucked up my stoma, had they not given me strictures and didn't listen to me, had the chain of events been different and my life been different, I would not have needed 3 weight loss surgeries to lose my weight. So for people to tell me that, well, TRICARE has been amazing to you because you've been able to have 3 weight loss surgeries. The second one that I had was not technically a weight loss surgery. It was a Band-Aid, which is what the strengthening of my stoma would be. It is a Band-Aid. It is not a weight loss surgery. It is not there to help me lose weight. It's there because I have a complication with my very first surgery. So again, I'm going to put that out there, that TRICARE is amazing and has done amazing things with me, but had I had something different done, and had the dice been rolled a different way, and I got another card instead of the ones that I've been dealt, I wouldn't have needed the distal bypass. So every doctor that I see that's a weight loss surgery doctor said they would have given me the sleeve first and then the DS if I needed it. Every single one of them. Not one of them has come at me with, I would have left you exactly the way you are. Not one. I'm just going to throw that out there for you. Not one that I've seen in the past 7 years, except for the ones which the civilian that actually did my original surgery. That's the only one, because TRICARE was not paying for the sleeve at that exact point in time. So it was still very new, and they weren't paying for it when I was getting my stuff done. They were doing the sleeve, but because I was military, and they just were not willing to put in the paperwork to get it done for me. It was easier just for them to give me the R&Y. I'm thirsty. So, because I'm running my big ass mouth. So, not that I don't appreciate your thoughts, not that I don't appreciate how you feel, but I don't agree with it. I feel like that I don't have to agree with it, that I can feel exactly how I want to feel about things that are going on in my life. And if you're not living my life, if you're not paying my bills, and if you're not in my bed at night when I'm being tucked in and kissed, then I could take what you have to say with a lot of grain of salt, because I don't have to um, feel whatever you want me to feel. Like I don't ask you to feel a certain way about your life, and I'd appreciate the same difference. What I'm doing is I've got dog hair on my hands, I've got it on my shirt, I've got it on my pants, I've got it on my socks, I've got dog hair all over the couch. And so no matter what I'm doing, I'm putting more dog hair all over my face. And it's making me nuts. It doesn't matter if I scratch my nose or don't scratch my nose. Like there. So now that I have that out of the way, so if you feel that you're being attacked, that's on you, boo-boo. You do you. I'm gonna do me, and I'm gonna continue to talk today about how I feel, because I'm having a hard time. I lost down. I am right now about 232, 235 pounds, because yesterday I ate like shit. So it's probably more closer to 235, but I was 232 with clothes on when I went to the plastic surgeon. The plastic surgeon was, in my opinion, rude to me, made me feel like shit. Pretty much told me that I didn't have enough breast tissue to even do a reconstruction. So TRICARE will pay for a breast reduction. They will pay for a peniculectomy. I already had a peniculectomy, and I don't have enough breast tissue to do a reduction. So right now, what I have fits in a B cup, and she told me, and I've already cried about it, and that's fine. She told me that the only thing that she could offer me would be a double mastectomy, because that's how little breast tissue I have left. And that really fucked me up. So that, she said that TRICARE will not pay for a lift, which is what I would need, and I would need augmentation up underneath the muscle of my breasts, up underneath the pec, because I don't have enough skin elasticity, and I don't have enough down. My breasts are way down here right now because I'm not wearing a bra, obviously. I'm completely flat chested. So a lot of people like to be like, ha ha ha, I don't have any boobs, ha, I lost all my boobs in weight loss. And I'm like, some of us actually have. So you have to have at least 15 grams of breast tissue to have it reduced, and I don't even have near that to be reduced. So she said the only thing that she could possibly do would give me a double mastectomy, which really fucking hurt my feelings. So but I cried about that yesterday and part of today and the day before that, so I'm able to actually talk about it today. She also told me that they will not pay for a tummy tuck. They will not pay for they pretty much won't pay for my arms. They won't pay for my legs. They won't pay for anything, because TRICARE views everything else as cosmetic, whether or not it is necessary, whether or not I have 15 doctors who say that this is medically necessary. TRICARE doesn't give a fuck. So unless I go to a teaching hospital, which is what we're kind of aiming for right now, or I win the lottery, or whatever, I will not be having any kind of plastic surgery. So I won't be talking about that for quite the while, if ever again. I don't know. But you know what? I am in a size medium again. I have lost back down to almost goal. And goal for me has always been about 230. Actually, my goal was to be 250. And when I got to 250, I decided it would be better to be 230. So now that I'm back where I was, there we go. So we're wearing 10, 8, 12, depending on what I'm picking up. And I'm just going to have to be happy with where I'm at. I'm just going to have to be okay with where I'm sitting. And, you know, I've worked damn hard and I've done what I'm supposed to and I've been dedicated. And this is a struggle for every day. Every single solitary day of my life is a struggle, and I'm just going to have to deal with that because you know what? I didn't get 500 pounds, 600 pounds, whatever I fucking weighed at my highest overnight, and it's not going to be the easiest fucking thing on the planet. And you know what? We don't always get what we want. So, um, if that happens one day for me, that is phenomenal. That is fantastic. If it doesn't, well, you know what? I gave it my best try. I have, you know, I haven't exhausted all of my options, but I'm just going to continue to be me and do the best I can every day. So, yeah, she hurt my feelings, and that that sucks for me. Um, but I'm alive, and I'm healthy, and that is the best I could ask for. And my wife is healthy, and my dogs, like I said earlier, my dogs are healthy. I have so much that most people don't, so I am grateful. Maybe not as grateful as you think I should be, but that's on you, not me. So I think I've talked about all of that. I think I talked about, you know, I won't be having any plastic surgery anytime soon, if ever. I'll reiterate that I'm still not going to have biological children, so we can stop asking about that. I'm not fostering right now. I'm not in a very good place mentally or monetarily to foster or adopt right now. So maybe later on in my life, me and Evelyn will do so. Right now, not so much. Where I'm at with my teeth are still falling apart. I actually lost a piece of tooth right here yesterday. I noticed that this one back here is broken as well. I've got a crack in another one. It is shitty genes. It has nothing to do with whether or not I brush my teeth. I already have a bunch of crowns and fillings, and all the fillings are what the ones that aren't crowns are the ones that are breaking. So that sucks. But I don't have the kind of money that you need to go and get that kind of stuff fixed, because none of them that have the fillings, they all need to be crowns, and a crown is about $1,000 to $1,200 a piece. And if I had that kind of money just sitting around, I would just go ahead and get my skin surgeries done and have I'd have implants done or whatever. And people will ask me probably, what about dentures? And at the moment, I'm not ready for that. So even if I was, TRICARE would have to pay for that, and I guarantee you if they're not going to pay for a fucking crown, they're definitely not going to pay for a mouthful of dentures either. So I'm not on disability, I'm not on Medicare, I'm not on Medicaid, I do not have any supplemental income besides what me and Evelyn have, so no, that can't be fixed either. I don't know whose channel has all these things that, that these people keep looking for, that somebody who's perfect, but you keep coming to the wrong channel looking for somebody who's perfect, because that ain't me. That is not who you're here for. So I hope everybody's having a wonderful day. I hope everyone is feeling good about themselves. I hope whatever you're going through today, just like me, that tomorrow will be a better day for you. I hope that no matter what you're going through, that things will look brighter in the future, that, not all is hopeless, not all is lost. If nobody told you today that you are loved, no matter how sassy I get in my video, remember, it is not about you specifically. So please do not take negative things from my video and apply it to yourself, because that's not, this is me venting and being able to feel better about the situations that I'm going through. And you're listening to me talk, and you can take things that I say to heart if you really want to, but try to take the positive things, like what I'm about to tell you now. Those are the things I want you to take to heart. The other things are things that I needed to just get out. I just needed it out. It has nothing to do with you as a person. I probably don't even know you, and even if I do know you, I probably have nothing bad to say about anybody anyway to begin with, because I just don't. Excuse me. I don't go to other people's pictures. I don't go to other people. I support everybody that I come across, and just because I'm having a rough day and you happen to come across this video, I don't always feel this way, and I'm not always going to be this way. So if nobody told you today that you are loved, please take this from me. I love you. Even if you think that nobody does, I do. If nobody told you today that you are beautiful and kind and considerate and compassionate, please believe me when I tell you I believe that you are, because you are here and you've listened to me bitch and whine and complain today. Thank you for being my friends. Thank you for being here to support me. Thank you for, oh my goodness, I'm so sorry. Thank you for just being here in general. I do appreciate it more than I can ever tell you, more than I can ever express. This channel means so much to me, and even though I don't make as many videos as I would like, knowing that you guys are still here when I do come and talk means more than you'll ever know. If nobody told you today that you would be missed, I would miss you. I would miss you. You are a bright, shining star. You are meant to be here. I hope to God that you're not in pain and that you're suffering and you think that nobody would love you and nobody cares about you, because I've been in that situation. I've had those thoughts, and I just want you to know that you're amazing, no matter how much dog hair I have in my face, and that you're gorgeous, and that you deserve more than you think you do, and that I love you personally. So I love your beautiful, gorgeous, amazing faces. Thank you for listening to me today. Thank you for whatever you leave me down below. Tell me what's going on in your life. Tell me how you're feeling. Tell me what you've got planned for Thanksgiving. Tell me how your family's doing. Tell me anything that you want. I do have moderators again, so I won't see negative comments. So you're just wasting your time if you're going to say something nasty. I won't see it, because I let other people read my comments before I even get to them. And then they send along the really nice, sweet ones, or the people that they know that I really care about. So if you're going to go cuckoo for Cocoa Puffs and start writing a whole bunch of keyboard warrior shit at me, I won't see it. So all I want to do is tell you that you're loved. All I want to do is make sure that you know that, just like me, if you're having a rough time, things will get better. So I love you, and I will talk to you very, very, very soon. Mwah. Hopefully next video I'll be much happier and I will be more positive. I'm sorry today's been more negative than positive. I will do my best to get out of this funk. Bye.